Hello, everyone. My name is Dot Behrens. I'm a nurse practitioner and an independent certified health coach.
Hi, my name is Pamela Clark. I'm an ICU nurse and I'm an independent certified health coach as well for Optavia.
And we're going to share today on how to create health for your patients, but also your practice. Just a brief overview on what we're going to be covering is number one, we'll be covering the innovative Optavia program to help your overweight and obese patients predictably reach a healthy weight while learning healthy habits, but then also lifestyle change so they create health for a lifetime and not just a point in time. And then we're also going to provide you some information on how you can use this in your personal or your practice with additional revenue source that stands outside of managed care. So this is me. This is my story. I've been a nurse practitioner for almost 30 years, and I've been coaching for a little over 4 years now. And obviously, I'm a wife, a mom, a grandmother, and an entrepreneur now of my business. I don't have a big weight loss story, but you can definitely see the difference when you have more of a higher protein diet. You can see that my muscle got leaner. And I actually signed up at a nurse practitioner conference, believe it or not. I was looking for something else for my patients because we know what a struggle it is to help our try and give options for our people who we know will do better if they could lose some weight. But then I was also looking forward to retirement, and I was looking for a source of income that I could do virtually because my children don't live around me. And so I wanted something where I would have income because I'm not the kind of stay at home, not do anything type of person. But I learned so much more with this program, more than I ever thought. I went on it first to see if it was a credible program, and I signed up within the first month of being on it. And I have learned so much with healthy mind and creating optimal health, and it still astounds me what I've learned through it myself personally.
I want to talk a little bit about our story, our credibility, and our mission. In the upper right-hand corner is Dr. Wayne Scott Anderson. He is our co-founder, and he's also our medical director for Optavia. He is a 10th board certified critical care physician. He worked for like 20 years bedside. He also worked in Dayton, Ohio on one of the biggest teaching hospitals out there in ICU. And when he started to notice that there were a lot of patients coming into his ICU acutely ill, a lot of them because of poor lifestyle choices, not so much genetic disposition. He saw a lot of diabetic, obese, hypertensive, high cholesterol patients, and he knew that prevention was key. What he was attempting to do at the bedside really wasn't fixing the problem. So he knew that he needed to take it to a preventative stance. So him and his wife, Lori, partnered with a company, Optavia, to be able to provide the tools and what was necessary to help people change their lifestyles, to change their mindsets, and to help them to eat healthy and sustain weight loss and live healthier lives and avoid the ICU. The middle picture basically shows our science is astounding. It's amazing the research that has gone into our plan. And these are just some individuals that are part of our research team, medical individuals who support us and make sure that our plan is efficient and effective for weight loss and safe for weight loss, which it is. Forbes magazine also in 2022 recognized us as one of America's best mid-sized companies, along with 2017 and 2019. We were recognized as one of the most trustworthy companies. And that's a nod to the healthcare backing and what we stand for in our community. And in the left picture is a picture of some buildings. We are actually based out of Baltimore, Maryland. We are an American-based company. And this is just kind of a picture to show you that what goes on behind Optavia. This is where our nutrition support, our customer service, where all the things that make us run so efficiently as a company are based. And what's so funny is you'll call the company and you have a direct line. You can call customer service, you can call as a health coach, you can call as a client. They step right up and help you right away. They're incredible what they do. But they'll always say to the coaches, thank you for being the best part of Optavia. But truth be told, they are the best part. We are the best part together with them, because we couldn't do what we do without them and their support. And that's why we love working for Optavia, because it's a great company and we have a lot of support.
So what we offer patients is a very innovative, comprehensive health program. It takes all the good components of the health programs that are out there and combine it into one program. And we are unique. We are the only program out there like this. We help patients reach a healthy weight with the support of a coach and a community while learning the habits on how to create it for a lifetime. So this is one of my coworkers, Katie. She's a nurse practitioner. She went on program and lost 30 pounds, and she has an amazing testimonial that we want to share with you.
Hi, my name's Katie. I am a nurse practitioner. I am an Optavia coach. I'm an Optavia client. So I just kind of want to share my story a little bit. I started the program about a year and a half ago. Dot had reached out to me and just asked simply one question. She just said, "Hey, Katie, do you want to hear about the health program that I'm doing?" And I was like, "Yeah, I do." About a month before that, I had some blood work done, and I just was feeling really tired. I had a lot of headaches, joint pain. I really thought I had something maybe medically going wrong with me, and all of my labs were perfect. Besides me being at the highest weight I had been in a really long time. So I knew it was time for me to do something for myself. I have 3 young kids. I'm busy. I coach, I teach religion class, like just lots of different things. So anyways, when I said yes to the program, it really changed my life. I feel so good. I wake up every day like I have a plan. I eat my fuelings. I have my lean and greens. I just feel like I'm more focused on a lot of different things. My headaches are gone, which is great. Joint pain gone. I've lost a total of about 30 pounds, and I just feel really good. The other thing that I really like too is I was kind of on the fence of should I coach, should I not coach, but really I was already coaching and I didn't even realize it. Once I started losing the weight, everyone was kind of like, "Katie, what are you doing? Katie, what's going on? I see that you look really good. You feel good." And so it was just easy just to kind of talk about the program. I ended up having my mom join and my sister join, and they were kind of my first clients. And that was just fun. Like we all lost a bunch of weight together, and we were just like, I don't know, just really involved with each other and supporting each other. So, yeah, so I enjoy teaching anyways. Like, I mean, we're all nurses. That's what we do. We teach, we coach. And so I just feel like Optavia has brought so much to my life. And I really think it can bring a lot to yours too. So Jennifer and Dot are amazing. They're great support system coaches for me. Anything I need, I mean, they are there. They are very knowledgeable. They're kind. Just have welcomed me with open arms. So the coaching support is amazing. The program's awesome. I really, really enjoy the fuelings. And then also like we have a Facebook support group called Healthy Friends that I really enjoy seeing people from all across the country like doing this program and just really diving in deep. And it's all about inspiration too. You see someone else doing a great program and you see yourself doing it and it just keeps you motivated. So anyways, if you're questioning if Optavia is for you, yes, it is. So thanks for having me today, and I hope you guys have a great day.
She has a beautiful story.
She really does.
So let's just talk just a little bit about statistics. We know what a health epidemic we have out there, and it's getting worse instead of better. These are 2013, 2014 statistics where 37.9% of adults over the age of 20 are considered obese. And the percent of adults age 20 and over with, or with overweight, including obesity, is 70.7%. Newer statistics from 2021, nearly 1 in 3 adults are overweight, and more than 2 in 5 adults, 42.4%, have obesity. And then we have a map, a visual map, where you can see the greater than 35%. There is like 4 dark maroon states there. And again, this is a little bit older data, 2015. When you look at the 2020 map, there are now there's 16 states that are greater than 35%, 16 states versus 4 before. And the green states, there were several on there. There were 7, and now there's only 4 that are in the green state. So we know it's a national epidemic. This is another visual. We know that you have a lot of reduction in a lot of disease when you lose weight, but this just lists them all out. We know that you decrease your risk for cardiovascular disease when you can get rid of or decrease your truncal obesity, and we know hypertension is going to improve. Heartburn is definitely going to improve. We see that in our clients' first week on program, and obstructive sleep apnea. We know that one of the treatments for that is weight loss, but also it has migraines. Katie mentioned that when she was eating healthy, she didn't have migraines anymore, and also asthma. Some of these people who think their asthma is out of control and then they start eating healthier, and it's more their weight that's causing their shortness of breath. So, just multiple healthy effects you see. So, Optavia is not just about healthy weight management and healthy eating. It also goes into what we call the macro habits of health, and it includes hydration, healthy motion, healthy sleep, and healthy mind is very big. So, there's 4 components of our system: the Optavia coach, the habits of health system, the community, and the fuelings. And we'll just touch briefly on each one of these. Number 1 is your Optavia coach. It's free to your clients. It's one-on-one coaching. And we do know that when you have a one-on-one coach, you're going to have better success. And the clients love it that you do check-ins with them. And I think on the next slide, Pam, it kind of gives some other examples of what we do as a patients, clients started on the program properly. We have this certain text campaign that we do when we start them out. We check in with them weekly. We plug them into some community resources, which we'll talk about in a little bit. We have a weekly newsletter that the company puts together that we can send to all of our clients. And also we have nutrition and behavioral support necessary for coaching. And the second part of the system is Dr. A's Habits of Health system. He originally wrote his first book about 17, 18 years ago when he first started on this health journey. And he will say himself that he's learned so much. It's not just about what you teach people to eat. They have to figure out themselves. There's a lot in the mind as to what the habits that you have and how that needs to be changed. So about 3 or 4 years ago, then he also developed a life book and updated his book too with what he had learned on this journey. And the life book is a journal for the clients to kind of figure out themselves, what's your strong why and what do you need to change and how can you go about changing it with the guidance. We walk alongside the people when they're going through the life book and help them get through it, but it empowers the person to figure it out, which they're going to have definitely more buy-in, obviously, if it's something that they choose. The third thing is community. And we put people into a like-minded group. We know to have a community surrounding us that are supportive, that you're much better in any area of life. And that includes with going on a health journey. Katie mentioned about being put into a Facebook group, a private Facebook group, and ours just happens to be called Healthy Friends. It's people on this same journey. So they find inspiration there. They share some of their stories themselves, or if somebody's, has found something that they're struggling with, and they just share that. And then there's also recipes and everything. So it's a lot of inspiration for them. And there's a couple other ones too that we share with them that help. There's a Pinterest recipe page. When we talk about the lean and green meals, which we'll talk about next, there's tons of recipes available for them to look at. And there's a nutrition hotline. If there's any problems or concerns, we have access to dietitians. And there is a smartphone app. They have weekly Zoom calls for the clients to listen to. And if they can't listen to them, they're all recorded so that they can even go to YouTube and even look up some of the previous recordings for any areas that they might be struggling with. The fourth part is reaching a healthy weight. And we have with the 5-in-1 plan up here, that's the most common one. That's the fast weight loss plan where they get put into a low, healthy ketogenic fat burn with an average of 10 to 12-pound weight loss per month. And that can vary. If they've got a lot to lose, they lose faster. If they don't have as much, they might lose a little bit slower. But we start them out right away from day one with a structured eating plan where they eat 6 meals a day. They're eating something every 2 to 3 hours. 5 of those fuelings are made up of a healthy plant-based protein, and it has vitamins and probiotics in them. They're all interchangeable, and you can see pictures of different kinds on the left-hand side. And then the 6th meal is a healthy lean and green meal that they fix themselves. It consists of a protein, and a green part is the vegetables. And you can see there the quantity is very big. They've got a lot of different choices that they can go from. And it's a very, very healthy meal. And we talk about the 5-in-1 plan, but there are a couple other ones. Well, there's more than just a couple that we'll kind of talk about in a little bit. But that sets them up for success for what a healthy meal is. There's so many people that don't know how to eat healthy. You probably found that out in your practice when you try and go over what they're eating. You can't believe sometimes that they don't even know what a vegetable is.
Yeah, very true.
So these are things that are that we see as positives with the program. Obviously, weight loss and weight optimization. And I talked about the average weight loss, and we often see a significant reduction in or elimination of some medication, especially those with high blood pressure, diabetes. I've had people come off of their diabetic medication, or at least cut their insulin way, way down and get off some of their diabetic medications. Heartburn is usually gone within the first week. And that's very, very significant that I see that. And cholesterol, I had a gentleman just a couple weeks ago who I think he's lost about 50 pounds in the program, and he can't tolerate statins. And went back to his cardiologist, and his cardiologist did all this patient teaching on this new injectable medication that he was going to have to put him on. But then when he had his cholesterol rechecked, his numbers were so great that the cardiologist told him he didn't need to be on anything and that he should just keep doing what he's doing. So obviously my client was very excited to share that with me. We do have different protocols that have a little bit of variation for type 1 diabetics. I have had type 1 diabetics on the program before, and they've done great. We have a lot of type 2 diabetics, and they do beautiful. We have one for seniors, teens, gout, blood thinners, and nursing mothers, and post-bariatric patients. In fact, I have a couple of post-bariatric patients right now. One has lost over 100 pounds. She's had 2 bariatric surgeries and gained her weight back after each one. She said no one taught her how to eat healthy. And so she is so excited. She's a new woman. And then I have another one who's doing really great too. And although I know some of the new centers now, they go more into nutrition. And so it's not that all bariatric programs do not teach healthy eating.
This slide basically goes over how we manage our clients on the plan. We use the 5-in-1 as an example. Unlike other plans, we actually not only help them in one phase of the weight loss, getting them to a weight loss goal, but we also help them transition into their maintenance or their optimization as well. So basically, you're going to bring on a client, bring on a patient onto the program. You're going to work them through the program, introduce it to them, make sure they understand everything they need to do. They hit their healthy weight, hit their healthy BMI. And then from there, we transition them into a maintenance plan, which is phase 2. And it's very methodically done, because if you're eating the 5-in-1, for example, we would start taking away some fuelings and adding some foods back to their regular diet. And that kind of stops the weight loss phase, but it also teaches them how to continue to eat. And what our clients love is that we follow them through to that phase. We make sure that they're hitting all the good habits of health that we've been learning about throughout the program. We emphasize on all of those with Dr. Anderson in the Life book. And then they get to kind of apply those and start to really learn how to maintain. Dr. Anderson makes it very clear that anybody can lose weight, but can they maintain the weight loss? And that's the most important part of this plan, is helping the client or the patient understand how to maintain it and keep that weight off, and then incorporate the healthy habits and lifestyle changes that still need to be made, increasing your activity, your exercise, doing all those things that creates what we call optimization. So this is me. I lost 65 pounds on the plan. As I said, I was an ICU nurse working night shift. Back in 2020, I was at my highest weight, 65 pounds overweight, really starting to struggle. Night shift, bedside, really my body ached. I was carrying on a lot of extra weight on my frame, and it was really getting harder. And I started having a lot of aches and pains in my body, and I was kind of in denial about my weight and my weight loss. And so I went to my primary physician, who was my nurse practitioner, and I wanted some answers like, what do I need to get healthier? How can I lose some weight? How can I do what I need to do? Unfortunately, she didn't have a lot of answers for me. Most of the things she recommended, I already tried. A lot of it was, well, you can eat higher protein, eat less carbs, exercise, join a gym. Those are things I did try, but what I really was needing is an eating structure. That's what I was missing. I had no idea the calories, the portions. I had no idea how to figure it out. I came across this plan from a friend who was a health coach and a nurse. She was coaching the plan. She was shrinking before my eyes, and I got on plan. She coached me through it, and I lost the 65 pounds, and it was amazing. I loved the structure. I loved how I felt. I felt like I had learned so much about how to eat and what to eat versus anything I had done before. And one of the things that was happening was I was still working bedside. It was 2020, so we were in the midst of COVID. I was working bedside, and all these nurses were like, "What are you doing? I want to know what you're doing. You have to tell me. Oh my gosh, tell me what you're doing, and I want to do it." So I realized I needed to help this population of people, which are nurses. We are one of the most unhealthy. We do so much for everybody else. We just don't think about ourselves, put ourselves first, make ourselves healthy. We worry about everybody else's health. So I felt like it was really important for me to have a mission to help my fellow nurses. So I came on as a health coach to help my family. A lot of my family members lost weight, my husband included. My children tried it, they loved it, and it really helped me with the health coaching. And then I started reaching out and helping my friends and my coworkers. So it just kind of flew very naturally. And I loved the health coaching part. I really felt like I was helping people more so than I was working bedside. Well, again, it was 2020 and we were in the height of COVID, and I was an ICU nurse working agency ICU, and surprise, surprise, I got furloughed. Furloughed meaning I was laid off. I was laid off for 2 months. And when you're an agency nurse not working, you don't get paid. There's no PTO, there's no vacation time, nothing. I had no income coming in. I was so grateful to have that health coaching in place. So I was coaching people from home. I was working from home. I was making an income, and I was helping contribute and support my family in the midst of COVID. I was helping people get healthy in COVID, which was amazing. And I was so blessed to have that in place and be able to still contribute financially and help my family in a time when it would have been pretty rough without me working. So I was just very grateful for things, and it was amazing to have that in place and working at that time. So I felt very blessed for that.
So we're going to go through now how to implement this service into your practice and also enhance your bottom line. So benefits to your practice, we've already talked about some. It obviously improves patient outcomes with your diabetes, hypertension, heartburn, decreased cardiovascular risk, decrease the risk for cancer. It accommodates patients looking for non-drug solutions. I got really burnt out writing phentermine prescriptions because you couldn't help them to learn how to eat healthier. Phentermine was about the only one that people could afford, although the newer weight loss drugs at that time, again, they weren't learning how to eat differently. So I didn't feel like they were very effective. I wasn't very effective. This empowers the patient, then they have control over their weight loss and what they're doing and not relying on a drug. The income source is not controlled by managed care. It promotes health care versus sick care, which us as nurses and nurse practitioners, we learn about health promotion, and that's one of our missions. And it definitely increases your referrals. I saw referrals in my practice. I work with 5 physicians, and like Pam said, her nurse practitioner didn't know how to help her. Well, physicians sometimes in our practice didn't know how to help the people that they knew they needed to lose weight. So they would refer them, you need to go talk to Dot. So they would come in and say, hey, Dr. Such and such said I needed to talk to you. Or people would come into the office and stating, hey, I want what somebody else had. Or it would be even outside of the office. I would help people outside, and I would get calls from people saying, hey, such and such, I know this person, and they gave me your name and phone number, and I want to do what they do. So there's 3 different options to implement into your practice. One would be if you didn't want to coach, you could refer the patients and we coach them, or you can join as a health professional or personally in Optavia, and we partner with you and you coach the patients with our help getting you started, and you keep all of the income. Or you can join as a health professional in general in Optavia, and we would help someone train someone in your practice to do the coaching, and then you would split the income.
Whoops, hold on.
So,
Let me go back. Sorry. There you go.
so this is just a picture of 3 different nurse practitioners, just to give you how it's different in everyone's lives. Heidi Bell is a nurse practitioner that worked in a sleep clinic. And so she dealt a lot with obstructive sleep apnea. And like I mentioned earlier, we know that one of the treatments is weight loss. So her and another nurse practitioner there in the office would talk to people about it there. Siddhatru is a nurse practitioner who works in primary care, but also works in the nursing home. She doesn't use this in her practice, but she does this personally in her personal time. And you can see her before and after picture, and she's a lovely person. Laura Markwick is a nurse practitioner who has her own independent practice, functional medicine, and you can see her before and after picture, and this has worked very nicely for her personally and her practice.
So some of the questions that come up about the health coaching, how do you create a substantial profit center? Well, you have the ability to have a significant add-on income potential of over 5 figures monthly. And I'll kind of go over that with you in the next couple of slides. One questions, and this is the best answer, is that we don't carry any inventory as health coaches. So Optavia provides the tools, provides everything that the patient needs to lose the weight, the fuelings and everything Dot talked about. We provide the health coaching component. So you do not have to have fuelings and tools or anything in your practice or at home. Everything is all handled through Optavia. You just have to health coach them on the program, which is awesome. They get the books, the fuelings, everything through Optavia. It's a low-cost startup to become a coach for Optavia. It's $199. And what's really great about that is it gives you your whole business. You can start coaching right away. It gives you access to Optavia's your account's back office, which gives you the business portion of your Optavia account. And basically everything is ran through there. And Optavia kind of realized that people that come on to health coach don't normally or typically have a big business background. So they take care of that and handle that business portion for you. And it's very easy to access. You can see everything at a click of a mouse, and you can really just run your business right from there. And it's really an amazing small place to be to manage this business and grow a business. And as Dot mentioned earlier, there is potential for repeat income because you bring on 5 people, they do really well. Their friends and family are going to want to know about it. They're going to want to do it. They're going to see the results. People are very vision driven. They see people losing weight. They want to do it. They see something that works. Your clients are your walking billboard. So when your clients are referring you other clients, or their friends and family, you have that really unique ability to grow your income pretty well. So a couple of strategies. There's 2 different ways you can make an income being an Optavia health coach. The first one, strategy 1, is patient focused. You basically come on plan as a health coach. And then you get income for supporting your patients, your clients on plan. So just an example, let's just say for a health professional coach compensation, there's no billing, no ICD codes, no worries about insurance. It comes straight to, it's between you and Optavia. Say you bring on 5 people your first month. You can generate up from $450 to $500 for those 5 people in just your first month. And as you build those 5 and they're reordering and then maybe bringing on another 5 each month, your client base will grow. And that money adds up quick. Even an extra $500 a month, could be a car payment. It could be so many places you could use that money. You could use it in your office. You can use it in your personal life, however you want to do it. So say you love coaching, you really love it, and you want to bring on more people, and it's just happening for you. You're 5 people who have referred you people, you have talked to people outside your office, in your office, you're coaching 25 people a month. And that can generate anywhere from $2,500 to $2,800 per month. And roughly, in order to coach people, bring them on plan, do the health assessment, monitor them on the plan, do your weekly calls, and maybe do a couple of virtual trainings, you're probably going to put in about an average of 5 to 8 hours a week. And that really spread out over the week isn't much at all. You can work it around your business. You can work it around your personal life. You can coach from the car. You can coach from your phone. It's actually very easy. We coach people all over the United States. They don't have to live near you. They don't have to come to your office. They can be your patient's mother in California. So it's very easy to do. We have Zoom, we do calls, we do it very easily and manage our clients pretty well. And it takes very little time to get them on program and get them going and doing and meeting up with them each week. The other thing you want to consider when you come on as a health coach is the certification that you can get. Optavia partners with Villanova University with their, they have a program called COPE. It's a Center for Obesity and Prevention and Education. And by partnering with them, we can get certified as a health coach. And it's kind of like you take a test like you would a CEU, you'd get for CEUs. And basically when you do a little bit of studying and you take the test and you can become certified. And the beautiful thing is it kind of really speaks to nurses, nurse practitioners, people in healthcare, because we're always looking for that little extra education, CEUs, all that good stuff. And we like to be, we like the knowledge base. And it definitely, when you do the certification, you do get a really good strong knowledge base on the program, the nutrition health, some information about obesity and risks and things like that, that really help you to manage your clients better. Now, Optavia does not, it's not a requirement to be certified, but they certainly encourage you to, because they will also pay you 3% more for being certified. So it definitely financially makes sense, as well as, for educational purposes as well. So just a productivity example. You're just basically getting income based on the amount of clients that you're coaching. So you have 40, say you develop 40 clients in a month. So your typical order volume is 356 a month. And that gives you an average volume of let's say $1,400, about $1,400, $14,000 in volume, sorry. That order volume times 31%, and the 31% is that's the percentage you get off of that volume, equates to almost $5,000 a month, which is pretty good. Say you bring on 60 clients per month, it's the same math. The volume is a little higher, times 31%. 60 clients can bring you roughly $7 grand a month. That's pretty good. Now you might be thinking, well, that's a lot to manage, 40 clients, 60 clients. I don't know if I want to manage that many clients at one time to generate that kind of income. There's another way to generate that kind of income without so many clients. But before I go into that, I also want to explain, on top of that volume that you're creating, your certification plus the consistency bonuses that Optavia provides for you as well really add up. Optavia's compensation plan is wonderful, and they really pay health coaches very well to do this job, to do the health coaching. So strategy 2 would be more what I was speaking of, as far as how do I earn an income, but not have to manage 40 and 60 clients at a time if I want to do something a little differently. This is the other approach. It's patient and health coach focused. So coaching clients on the program, coaching patients on the program, also including inviting, orientating, and mentoring coaches to do what you do. Our system is very repeatable, it's very easy to teach what we do. It's a duplicatable system. When you learn how to coach clients, you can teach someone else to coach clients. It's very spelled out. There's no real gray area. This is what you do, and this is how you do it. And it's really easy to follow. And you can start your business very quickly and learn very quickly with just 5 clients. Learning the structure. Then you can go and you can teach that structure to someone else. It could be a client that's doing really well on your program and really wants to share it with their family and friends and might want that extra income as well. They can come on board as a health coach with you. It could be a nurse practitioner in your office who's watching what you're doing and loves it and has people inquiring with her. They can come on as a health coach as well. And you can mentor them, and they're coaches, and they'll work with you, and you can mentor them to do what you're doing. And then you can generate an income that way as well. And I'll kind of show you what that looks like. So this slide, basically, this is kind of a little bit of a graph, which kind of gives you an idea of how all this compensation works. So the first 2 lines that are up here, getting started, taking certification, and then early on, basically those two lines represent patient focused, where you're just bringing on clients. You're averaging anywhere from $1,000 to $4,000 a month, depending on how many clients you're bringing on. It could be 5 to 25, and they use that just as an example. And then as you grow your business and you decide, okay, I want to bring on some coaches to do what I'm doing and bring on coaches who are going to bring on clients, you get a percentage of their income as well. So for the first few years, you bring on a couple of coaches who are doing exactly what you're doing because you've trained them to do it really well. And you can make between $5,000 and $10,000 a month. And then early years in future, grow and increase that as you bring on more coaches who are doing exactly the same thing you did. Again, it's a very coachable system. It's a very easy system to follow. It kind of goes along the lines of what we do as nurses, nurse practitioners. We precept, we orientate. Sometimes walking into a situation where you're being trained in healthcare is like an apprenticeship. You get taught something, you follow it, your preceptor works with you, helps you grow, helps you learn, and then they kind of go off and spread their wings. And that's how this works. We will help you do that as well. That's how we help you grow your business And Dot and I have had the same experience with our business mentors as well, which has been amazing. So, oops, let me just go back a slide. So this is basically our income disclosure statement. Anytime we talk about income on Optavia, we do have to disclose this. This is basically just earnings range and percentages that you can look at any time. It's available on the internet, and it's also in our Optavia website, and you can look at that at any time. It kind of just gives you a rundown of different incomes based on ranking. So again, it's easy to get started. It really is a turnkey operation. It's $199 to get started. Again, Optavia does all the business end portion for you. You go into the business section, you go into Connect is what we call it. In there, there's a great template to create a personalized website for yourself that you can share with your clients or potential clients. It's also a great place that you can manage your clients, your patients on the program, and on the, to kind of see where their orders are at and how everything's working business-wise, how your income is generating. There's also areas where you can go into virtual trainings. You'll be doing trainings with, if you came on with us, Dot or I and whoever else are business coaches, we would invite you into virtual trainings and be part of your business coach support team. We have a team coaching concept. We all coach together. We learn this together. Nobody coaches alone. You will on occasion do your own thing, but we are all there to support you. You won't do it alone initially. We will be there to help you learn how to do it and until you get comfortable doing it. And we support you. And there's many times I still reach out to my business mentors about clients or a certain particular issue. I always have this amazing support doing so. And then once you get started and you come on board, we help mentor you. We start your training calls. We get on health assessments with you. We kind of model the health assessment for you so you know how to do the health assessment portion of a potential new client, how to onboard them, how to celebrate them. We do all that with you. And then you kind of get the flow. And that's part of what we do. We coach you to do all of that. We would love to bring you on board with us. We'd love to have you come work with us and maybe, consider growing this business. I think you'd find it to be really a lot of fun and just really something really rewarding. So we look forward to maybe hearing from you.
So hopefully we have explained it well for you. But this is how you can contact us. Although if we had sent you some of you original emails, you'll have our email address. And please reach out. And hopefully this has been helpful. We'll be talking to you soon.
Yes,
So,
thank you so much.
okay, bye.